Hey guys, how are you? It's Layla here, and today I'm finally filming the highly requested video on the FAQ about rhinoplasty. Most of you guys probably know that I had rhinoplasty done on November 15 on my nose, and it's now been over 7 weeks, 6-7 weeks. So I've been meaning to do this video for a while, and today I'm finally ready to answer your questions. On the last video where I revealed the results, I asked you guys to submit your questions if you had any about the rhinoplasty procedure and the experience and everything like that, and I got so many questions. So I have a list here and I'm just gonna jump right into it because I don't want to talk too much, but there is a lot to cover. So I'm gonna be looking on the screen there and answering the most frequently asked questions. So the first one is, why did I decide to do this procedure? And I already have a video on it on this channel called Layla Has Something to Share, I think. And basically I describe in detail why I decided to do it. But in a nutshell, when I was younger, I think I was maybe 11 or 12 or 13, probably around 11, 12, I broke my nose and it was broken and crooked. So I just wanted to fix that problem because I knew that eventually I would probably have to I will probably have some breathing problems, and also aesthetically my nose was crooked, and you know, I just wasn't born with that type of nose, so I wanted to have the nose I was born with. So that's why I decided to get my nose done. The next question is the obvious one, and it's, how do you go about looking for the perfect doctor, the perfect surgeon for the job? And of course it is your face. You want to have the best surgeon possible. So what I did is I went onto Google and I just typed in best rhinoplasty surgeon in Toronto area, whatever, and I started just reading about the best ones, reading testimonials, looking at their websites inside and out, looking at the before and after pictures. So once I've narrowed it down to top 2 Toronto surgeons, I set up consultations and I went to see both of them. And I think when you go to see someone and you have that personal interaction, I think for me at least, because I'm very intuitive and I kind of feel a connection with people, and I knew that once I had that consultation in person, I would have a better idea of who would be my doctor. And I was right. The first one, and I'm not gonna reveal the names, I was gonna reveal the names because I'm so gullible and so naive, and then Mimi actually brought it up and said, listen, if you tell them who your surgeon is, I'm sure there's gonna be some people who are gonna think that you got the surgery done for free and you're just doing marketing for them. So I'm not actually going to reveal the name. But if you do want to know who my personal surgeon was, then you can email me here on YouTube and I will get back to you with the name. So I'm not going to reveal that for, you know that there's going to be some people thinking that I got the surgery done for free, and that's obviously not the case. I did have to pay for it. In any case, so the first surgeon was great. He's obviously, one of the top 2 or top 5 or whatever in Canada, in Toronto, and the consultation went great, I thought, until I had the second consultation, and that's when I knew the difference. I just felt like the second doctor definitely, which is the one I chose in the end, definitely connected better. He was very interested in knowing what happened, what kind of nose I wanted, what kind of results I wanted to achieve, and he just had that more of a personal connection. He was making eye contact, and I just felt more comfortable, and definitely knew once I didn't know immediately, but once I left and kind of compared the two in my head and just reflected, I knew that he was the one, because he just was more engaged, he was more connected, he just felt like he cared more, and the first doctor just felt a little bit more disconnected. And I don't blame them. I can only imagine how many people go through the office and how many people they see. So maybe he was having an off day, I don't know, but personally I just connected with the second doctor and I just knew that he was the one. So then I obviously just booked my surgery. So that's kind of the process of how I found the doctor and how I knew he was the one. So just as a bottom line, I rely a lot on my gut feeling and intuition. So I knew that once I had the meeting in person, I would know. So that would be my best advice, is just go with your gut feeling. Obviously, you do want to do a lot of research and read about past experiences, look at their before and afters, like I said. But ultimately, once you've selected out of the top whatever number, you just go based on personally on your intuition. So that's that. What was the consultation like? Was the question that a lot of people wanted to know, and that's depends on the surgeon, but mine was probably, I'm going to be talking about the one that I chose. It's basically you sitting down with them and telling them what's wrong with your nose, what happened, if you know it has been broken or whatever. And then I brought a lot of pictures of the shapes and the proportions of the noses that I thought would suit my face. So I kind of just showed the pictures of that, and we discussed, and he was very, very honest about what he could do and what he couldn't do. You know, he wasn't promising me the world and telling me he was gonna make me the most beautiful person. He was really honest and just kind of realistic about what he could do and what he couldn't do. And I was really happy about that, because that just shows to me that this person is, you know, real. He's not just there to make you believe into something and not deliver. So yeah, so I would say it lasted maybe about 15 minutes, 20 minutes at the most. And you know, it's all about just looking at the profile, looking at the front view, and just deciding on the results that you want to achieve, and him describing what kind of procedure he would be doing. And yeah, so the next question here is, what shape will work best for your face? I think I'm an artist, like I studied art and I know proportions and things like that, so I knew for myself what shape I wanted and what I didn't want to happen. So I think just maybe doing a lot of research would help on if you have a round shape or a narrow face or whatever, oval shape or whatever, and just looking at different people with this the nose shapes that you want, and then just collecting some of the pictures that kind of make sense to you. And of course, your doctor should know exactly what should look good on you, because he's the professional. So ultimately, I think it is between you and your doctor to decide the shape and the proportion of the nose that you should be going for. So the next question is kind of along the lines of what I was just discussing, and that's, how did you choose how you wanted it to look? And I just knew for myself I wanted it to look natural. I just wanted to get rid of the bump that I had and fix the crookedness, because my nose was crooked towards the left side. So I knew I wanted to get rid of the bump and fix the crookedness. I just wanted my nose to be as straight as possible. And when you start changing a certain thing about the nose, you might have to tweak, let's say, the tip as well, because it would just look out of proportion and it would look weird. So my surgeon did discuss that fact with me as well, that he would have to address the tip also, which I was very happy about, because my tip was a bit droopy, and I knew that once you get rid of this bump, it would just kind of accentuate that. So he did also fix the tip a little bit by bringing it up just a bit and kind of I guess bringing it in a little bit, just to have a more proportionate shape and nose for the shape of my face. So that's how I decided on how I wanted it to look like. The next question is the price range, and I'm not going to tell you the exact price, because it will definitely depend on the surgeon, on where you live, whether you live in a small town, in a large city, and things like that. So I'm giving you a base kind of price range, and I think it probably depends. For the good ones, I know you can get it really, really cheap, but I personally wouldn't risk that, because it is your face and you don't want to, you know, you don't want to play with that. So I would go, if you can afford it, of course, for the best of the best. And I think it ranges from 5,000 to 7,000, maybe sometimes more, but I think that's kind of like the middle range. So that's the price range. So the next question is whether or not I had open or closed procedure. The difference between the two is, in the open procedure, they make a small incision at the tip of the nose, and basically that's done to kind of have easier access to create, I guess, better results. So during my consultation, I asked my surgeon whether he thinks he'd be doing open or closed, and he said he will try to do a closed one, but he thinks he might have to do open. And because I trusted him completely, I gave him kind of free will to kind of do as he sees fit during the procedure, because I obviously wanted him to do the best job that he could, and I knew that if he has to do the incision and just kind of get in there and do what he needs to do, then I kind of gave him the free will to do that. So mine was open, so they did have to make a small incision, but honestly it's right underneath, so you won't even see it. And at first, of course, it's swollen and everything, but it wasn't a big deal to me. I wanted to make sure that he achieves the best results possible, so if he had to do open, then I was okay with that. So next question is on whether or not you're awake during surgery. And you are not awake, you're put under general anesthesia. So what they do is they put you under general anesthesia, they put an IV right here into your vein, and everyone in the operating room was so sweet and so nice, and so they kind of crack jokes with you and to make you feel comfortable, and you know, the guy was explaining that once he puts the IV, I'm gonna feel some kind of coldness running through my veins, and then count to like 3 or 5, and then you're gone. Basically, you fall asleep and then you wake up right after surgery and you don't feel a thing, and you feel like you just fell asleep and you woke up. You don't know how much time went by. And once you wake up, you have to, because you're still under the anesthesia, you have to start breathing a lot through your mouth to make sure like the anesthesia comes out of your system. So they tell you to just start to breathe deeply through your mouth, and that makes you like feel better because you're very dizzy and you feel a little nauseous and stuff. The obvious question after that is, do you feel any pain during or after surgery? And of course you don't feel any pain during surgery, which God forbid you would have to feel that, because of course they go in and they do their thing and you don't want to feel that. That's why you're put under general anesthesia. So no, you don't feel any pain during surgery. And right after surgery, I think it's mostly discomfort. I had a little bit of pain, but you're given painkillers, so you're not really feeling any pain. And I personally didn't even need painkillers. I thought I was gonna be using like for the whole week because I didn't want to feel any pain at all. And honestly, I stopped taking painkillers, I think after the second night. Like on the second night, because you have to take it, I think every eight hours increments. And at the end of the 8 hour on the second day, I was like, honestly, I don't feel anything, so maybe I shouldn't take it, because when you do take the painkillers, the side effect of that is that you might get constipated. And I hate feeling that way. You know, you want to be healthy and you want everything to work smoothly. So I just decided not to take it and see how it feels like. And I didn't really have any pain. Of course, if you touch it, obviously you're gonna feel it. But if you kind of are careful and you don't touch it or anything like that, you're not. I personally didn't feel any pain. So that's about the pain. Now the next question is, did they stuff your nose? And I know that from the past from the past patients of this surgeon, that he has stuffed noses in the past. And I don't know if it was just my particular case or if it's like a new thing that he's doing, but thank God he didn't stuff my nose, because it would probably be very uncomfortable, because I'm very sensitive to stuff like that. And he did not stuff my nose, which was amazing. So I was still able to not really breathe, because it is all swollen in there, but you can, if you really wanted to, you could kind of still have some circulation and breathing going on, as opposed to having it completely stuffed. So no, they didn't stuff my nose, thank God. What they did do is have, I forgot what it's called, mustache gauze, I think, which is, and if you watch the first video of like me revealing the results at the beginning, you can see right after surgery what it looks like. So there's a cast right here. It's like I guess like a plastic or something like that cast, so it doesn't move. And then they tape your nose from like over here like that, so the tip is kind of lifted. And then you have to wear a mustache gauze for the first, I think maybe 1 or 2 days. And that just catches any blood drippings, so you're not like messy and anything like that. I think I only needed to wear it for like 2 days, and after that the bleeding stopped, so I didn't even have to wear the mustache gauze. So it's honestly not that big of a deal personally. My nose. And the next question is, were you able to sleep the first couple of nights breathing through your mouth? You do have to breathe through your mouth, and that was one of the most uncomfortable things for me by far through the whole kind of experience. And the fact that you have to sleep on, like, you can't really go on your side or on your stomach, and I sleep on my stomach, so it was definitely uncomfortable to have to sleep like upright, basically in this position, maybe a little bit more down. And that was very, very uncomfortable, but honestly, it's not a big deal. You just maybe do that for the first week. And considering like that your whole life will change after the results, I think it's a small price to pay. So yeah, that was uncomfortable, and breathing through your mouth, because your mouth gets all dry. And I just kept, you know, my water bottle next to me, and I just had to drink a lot. And of course, when you wake up, your mouth is dry, and that part is very uncomfortable. And another uncomfortable part about the whole experience was not being able to blow your nose. It's so like silly to think about it, because you don't really think about what kind of privilege it is to be able to just blow your nose. Or when you're washing your face, I couldn't obviously wash my face. I just had to kind of, you know, wash it around this part. But, you know, once the cast was off, then I could wash my face. but you can't blow your nose for like the first 2 weeks, and that was so hard for me. That and the sleeping part was the two, probably top two most uncomfortable and kind of negative parts throughout the whole experience. So that's that. Next question is typically how long does swelling last? And I did some research and I found out that there's two natural remedies, I guess, that you can take and apply that help with the swelling and the bruising. And I was definitely concerned about the bruising because I normally bruise easily and my bruises stay for a long time. So I wanted to make sure that I did anything that I could to prevent the bruising from staying a while. And I don't know if it was because of the things that I was taking or just my body naturally reacting to it, but I honestly didn't even have that much bruising. I had some bruising over on this side under my eye, but it was really, really insignificant compared to what the pictures I've seen or what I thought I was gonna have, which was strange. But I did have some swelling, and it's around kind of like right here and obviously around your cheeks and like where the nose meets the cheeks, like around this area. So for me, the swelling, the worst part was the first day you don't have that much swelling. The next day is kind of like, whoa, it just sets in. And Mimi was joking when I first got home. She's like, oh my God, you look like Michael Jackson. And then the next morning I wake up and she's like, oh my God, you look like Avatar. So every day as the swelling and the bruising kept changing, she kept coming up with new nicknames for me, which was funny. But yeah, so the swelling I would say lasted the first, the worst of it was like day probably 2 to 5, and then from there it just starts going down. So you're probably gonna want to know what I was taking to help with the swelling and the bruising, and it's called, there's two things that I did, and I did both, which was probably a little bit redundant, but I just honestly wanted to make sure that I did everything I could to reduce the swelling and the bruising. And it's called arnica, and there's pellets that you kind of dissolve, under your tongue, and then there's also a cream that you apply topically, and then there's also another thing called Trumil. I'll post the both names in the bottom bar. And basically both of those, it's not just for rhinoplasty, but with any surgery that you kind of undergo, and it just helps with the swelling and the bruising naturally. So I think maybe those things definitely helped. And then maybe just how your body naturally reacts to things. So the next question is, was it still sensitive to the touch after 2 weeks? And yes, of course it's still sensitive to the touch because your nose is broken and healing for the first, I think, 6 weeks. So after 2 weeks, I think on day 10 is when I went and removed my cast. And honestly, that was the most craziest and surreal feelings ever, because I think it was his assistant or whatever, she removed the cast, and I haven't even seen what it looks like yet. The first thing I did is just went like that, and I just ran my finger down the part where the crooked part was and where I had the bump, and I just did that, and it was just so weird and so surreal not to feel the bump there anymore, and it was just like just feeling it straight. That was like the craziest feeling ever. And then you look at it, and of course it looks pretty bad, like you're still very swollen and everything, so it looked weird. Plus you still have some swelling around and everything, but I was definitely happy just not seeing the bump. And the front looks weird, and the profile looked really good with not seeing any, any bumps or any crookedness. So I was definitely happy, but of course you feel a little bit like, oh my God, it looks so bad right now because of the swelling and everything, but you know that it's gonna go down, so no big deal, you just have to be patient. But back to the sensitive thing, yeah, it's still very sensitive, and I still kind of feel uncomfortable wearing sunglasses. I don't wear glasses like day to day, but when I am outside, my eyes are very sensitive, so I kind of have to wear glasses, but it just feels a little weird, like when the glasses are down, I guess maybe the pressure from just pressing on the bridge right here, it doesn't hurt, but it feels a little uncomfortable even to this day. But it's not a huge deal that I can't wear them. I still wear them, it just feels weird. Yeah, so yeah, it still feels sensitive to the touch, and you should be very careful for the first 6 weeks because it's still broken and it's still healing. So that's that. Next question is, how many days did it take for you to be able to go back to work or out in public? Like I said, I think he took off the cast like 1 day short of 2 weeks after surgery. And you could go in public. It's, you know, if you kind of mask it up and stuff like that with makeup, you could definitely go in public. But I would say to feel more comfortable, maybe after like 3 weeks. And again, you can go in public, like you don't look like anything from the outside. If nobody knows, they probably won't know that anything is going on, but you knowing your own face and everything, you'll know that's, you know, obviously you're still a little swollen and everything. So I would say to be like completely comfortable, about 2.5 to 3 weeks to go out in public or go back to work. And again, I think it's gonna probably depend on the person and how fast you heal. The next question is, how does your nose feel now? Is it numb? Did you have any damaged nerves? And do you breathe better? So my nose right now feels, like I said, it feels fine. I mean, I can apply makeup, I can touch it, it's fine, but it does feel a little bit more like I can kind of feel it a little bit at the bridge. And the tip, I had some numbness at the tip for a while. I would say maybe 3 weeks. But it's going down every day. It's going down, and I can feel more and more. I think right at the very tip, it's still a little bit numb, very, very little bit, but you know, I can definitely feel it much better than it was before. So it's just about being patient and just waiting for your body to naturally heal and go back to its normal kind of self. Did I have any damaged nerves? Not that I know of. I feel everything. Everything is fine. Like I can feel everything everywhere. So I don't think I have that issue. And do I breathe better? I haven't really seen any difference with the breathing. I did see the doctor, when was it? 2 weeks ago. And he told me that it's normal if I have some congestion in the sinus area. It's totally normal because you're internally still a little bit swollen. Like I'm definitely still swollen in the tip, and like I've mentioned before, it takes a full year for all the swelling to go down. So, and he told me that I didn't even think the bridge was still swollen, but when I saw him like 2 weeks ago, I think, he said the bridge is still a bit swollen, like right here and right here, it's still swollen a little bit, but most of the swelling is right in the tip area, and that's where you have to be patient and just wait for it to just the full year to pass to see the full results. So yeah, with the breathing, I breathe fine. I don't really notice any difference. The next question is, how do you clean the nose? And I'm definitely one that's not afraid of touching wounds and stuff like that. So I was cleaning, and you have to do this very carefully and stuff like that. And they will give you a package describing how to do it and all the medications and things like that that you kind of have to apply and clean with. So I'm not going to go into too much detail, but I was already cleaning it very gently on the first night because I could feel like, and this is going to sound gross, but like the blood and everything to just crusting around, and I could not take it. I had to like very gently just clean the inside. And maybe you shouldn't do that, like ask your doctor, because maybe you're not allowed to, but I couldn't take it. Like I had to just, and what you do is you take a saline water, I think, or saline spray, and you kind of spray it into your nostrils, and then take a Q-tip and just very gently, like carefully just kind of wash it off. And you do that a few times and it just cleans everything, and you can breathe better and you feel better because it doesn't feel as stuffed. So yeah, I'm okay with doing that kind of stuff. So, but I'm not going to tell you whether or not you should do it. You should definitely discuss that with your doctor. Yeah, so I was clean, and then you apply polysporin. They told me to apply it like as many times as I can because it's gonna obviously help with the healing and everything from the inside. So every time I would clean it, I would finish off by applying a little bit of polysporin in the inside and then at the tip, because I did have the incision done there. And as for the stitches, they were dissolvable stitches, so they don't take them out. They kind of just dissolve by themselves and fall off. As I clean them, sometimes one would just come out and stuff like that. So it's just about being patient and waiting for it to kind of do its thing and dissolve. Last question is what the side effects were, and someone said that I think you can't smell food and stuff like that, and do you taste and everything like that, and what was your appetite? So the whole thing with the eating, it's definitely hard to chew and I didn't really have an appetite, so I ate soup for the first week, I think. I honestly, and I love to eat, like anybody who knows me knows I love to eat. I didn't really care for anything. I just had mostly soup with, like, I would put bread in it and soften it and then just eat that. And yeah, like eating was a bit of a, you know, you don't really care for eating as much, you don't really want to, and it's hard to like open your mouth and everything because then you're pulling on all these muscles. So soup is definitely like the best thing to eat, I think, while you're healing. And I think that about covers all of the questions. So I guess as the last thing, I'll just turn around and show you guys the profile views of what it looks like. So from this side, you can see it's very straight and the bump is gone. The tip is still very swollen, but it's gonna get better and better as the time goes by. And then from this side is where it was the worst because it was kind of crooked towards the left side, so it was really obvious from here. And yeah, so it looks straight. And I will probably post pictures before and after, maybe at the beginning of the video, to show you what it looked like and what it looked like before and the progress to now, which it's still gonna keep changing. But anyways, so as the closing words, I guess I will say, if you are considering it, personally, and this is like any kind of plastic surgery is, I think, a very personal decision and one that you have to make for yourself. And personally for me, rhinoplasty was the best decision of my life by far, like 100%, because I now feel like myself. I feel like I have so much more confidence. Not like I had to worry about things before, but I think subconsciously I always had that kind of, I don't even know, like I guess awareness of my nose and constantly thinking and worrying about it. Like which angle my face is at, which angle someone's looking at my face, or if I was taking pictures or on video, I was always kind of aware of the angles and who's looking where and stuff like that. So now that that's gone, it's like, I can't even describe it. It's like words really can't describe it. It's like an internal feeling that I just feel more like myself and I don't have that kind of worry anymore and that subconscious kind of dragging feeling. So for me, it was the best thing that I could have done and I'm so happy that I did it. Honestly, the few little uncomfortable things that go along with it were so worth it to me because it's like for 2 weeks or whatever of that discomfort and maybe a little bit of pain and stuff, to have your whole life after that change for the better, to me that's a small price to pay. Again, this is personal decision. I'm not trying to sway you into doing it or not doing it. It's like 100% personal decision and one that you have to make for yourself. And for those people that, I know there's a lot of people that kind of feel maybe, you know, that nobody supports them in that decision. Honestly, for me, nobody thought that I needed it. Anybody that knew that I was getting it done, I could feel were like, oh, why are you doing it? Like, you really don't need it, you're fine, stuff like that. And, you know, they were fine once they knew that I'm decided I'm gonna do it. They did support me in the fact that, you know, hey, if that makes you happy, we're behind you. But ultimately, nobody thought I needed it done. So if you have people in your life, like family or friends or whatever, and if you feel like you need something done and everybody tells you, oh no, you're fine, you don't need it done. Of course, if people love you, they're not gonna tell you, oh my God, yeah, like your nose is so ugly, like you need to get it fixed. Of course, they're not gonna say that. Of course, they're gonna say, no, you're fine, you don't need it done. So personally, I feel like if you feel that it's gonna make you happy and it's gonna change your life, go for it. Like, life is too short. You know, it's your face, it's your decision. If you wanna get it done, you get it done. If you don't wanna get it done, don't do it, you know. But I think ultimately you should have to make that decision for yourself and not allow anybody else to influence your decision. So that's it. I don't want to talk too much. I know this video is already super long. And yeah, I just hope I was helpful in answering some questions that might, you know, naturally arise with thinking about rhinoplasty and the whole experience. So I hope I was comprehensive about it and covered everything I could. Yeah, I hope you guys enjoyed this video, and if you do end up getting it done in the future sometime, best of luck to you, and I hope yours is just as successful as mine was and that you're just as happy with your results as I am. Thank you so much for watching. I will see you guys in the next video. Bye!